Thank you very much, Anna, for your presentation. And thanks to the organization for the organization precisely of this event. It was a conference, a very much expected conference. We wanted to have this international conference on this DAO deficit. We all of us here, well, we could say maybe they were experts in this because we have many years behind us. And well, I know that we have to stick to our time available, so I'm going to start my speech straight away, in which the first part was devoted to offer a summary of the scientific evidence published, but I will skip it because we're running a little bit behind schedule and because that's already been presented this morning by Marc-Gabriel Vidal and also Dr. Ojeda. And what we are most interested in today as dietitians and nutritionists, and with the experience of visiting so many patients with DAO deficiency, the most interesting thing, as I said, is to talk about what is our way of working, the empirical evidence, the clinical evidence in our daily basis with our patients in our surgeries. So that's why I wanted to share at the end of my presentation a clinical case that I think that will bring you closer to reality in a more practical way. As I said, I had prepared a brief summary of all of the studies that talk about treatment at the level of low histamine diet and supplementation, but we've seen it. So very quickly, I will sum it up. And what I wanted to show you with these tables, with these studies that you can find in this revision published by my colleague, Dr. Oriol Comas, a year ago. What we found here is that in spite of the very few weeks that these studies can have, or the low end at the level of subjects, that all of these studies show an increase which is over 70%. This is a very relevant piece of data because not many times, and we're talking about 20 studies more or less, and all of them ended up concluding that there was an improvement, which we would say is dramatic, over 70% in the improvement of the symptoms. We have already talked about this study in the 90s, but we come from there. Then already we talked about histamine-free diet, and nowadays we cannot use that term because, as we saw with La Torre, it is very difficult. It's hard to think about histamine-free diets because the majority of foods contain histamine or other kinds of amines. But then they talked about histamine-free diets. These are relevant data that were a starting point for the finding of treatments to treat chronic headaches. And this table that I took out of the study already showed, as La Torre said, showed these foods very well classified, and there's no doubt that all of these elements, all of these foods contain histamine, and they would be withdrawn from these kind of diets. But nowadays, they have included so many more foods, be it through the clinical experience of patients or thanks to scientific publications of the different research groups. As we said before, I'm going to go through it very fast, but you're seeing in detail all of these studies in this first group of slides. They would apply to low histamine diets, and then there is an improvement of symptoms, which is very high. At the level of gastrointestinal disorders, dermatological ones, and neurological ones. And then there is another group of studies that have been commented on throughout today's sessions that would deal with the DAO deficit with the DAO supplementation. with patients that have digestive symptoms or neurological symptoms or dermatological symptoms. And the improvement of the symptomatology of these patients is very high. This is a study of 2018 where this is very mentioned in very much detail, where we would see a significant reduction of the urticaria, the chronic spontaneous urticaria. This is a study, the one at the bottom, a study that we published 2 or 3 years ago in the conference of the Spanish Society of Nutrition. And our nutritionists group, our team, together with the research group of the University of Barcelona, we wanted to publish the work that we had been doing in an observational way with a quite high N, more than 200 patients with migraine, where we applied low histamine diet and DAO supplementation. So the two treatments that have been being recommended throughout the literature that we have also seen today. Because at the end of the day, that's what we do in our surgeries. It's not only diet or supplementation. We have a nutritional training somehow, but today we know that it's impossible to have a completely histamine-free diet. So we need to help ourselves with the supplementation. The result was really positive. There was an improvement in the case of patients with migraine that would reach 80% or more than 80%. And what you see here is that nearly 36% of patients would reduce the duration and the intensity of the number of migraine crises, and 35% of patients would stop having these migraine crises. So there was a full remission of it. These two studies have been mentioned today by Dr. Izquierdo. That's the first one of them, where we could see a direct relationship with DAO supplementation in migraine patients. And in this second one of Dr. Wolfram, who couldn't be here today, we could also see a reduction, an important reduction in all the symptomatology of the studied patients. And well, now I'm going to talk about the treatment that we applied to those patients with DAO, histamine intolerance by DAO deficiency. The treatment is based on two essential pillars. On the one hand, we talk about diet, and on the other hand, supplementation. Diet, as we've seen, is not just a diet which is low in histamine or food-rich histamine. We just use that name because it's simpler for the patient, and in the different literature we talk about that as well. But we do also have to take into account all those foods that are rich in other amines like putrescine, cadaverine, tyramine, because somehow they compete with histamine because they're also metabolized by DAO, and it avoids histamine to degrade appropriately. So you would have, for example, a very healthy breakfast like orange juice with toast and cheese, right? And this orange doesn't contain histamine, but it's got putrescine. So we have to eliminate it in the same way, because then otherwise a patient will not improve, most of all in a first phase of low histamine diet. There's a third group of food that we should restrict at the beginning of the diet, most of all, are those considered histamine liberator foods. They are present in some of the lists, but we don't know the mechanism through which they are acting. They're not activating immunoglobulin, but they do not contain histamine. But we can see, and by what the patients tell us after consuming them, there are not many of them, but we need to take them into account in low histamine diets. And finally, we would have the group that we consider to be DAO blocking or inhibitors that would be those alcoholic drinks, because ethanol, as we saw in the morning, in the metabolization of histamine, is present or uses an enzyme of these for this histamine degradation, so it competes as well in the process of this metabolization. In this group, would be very important or significant, so to speak, this alcohol, this double fermentation alcoholic drinks like wine, cava, champagne, or beer, because they have a higher load of bacteria and they could contain more histamine than other distilled alcoholic drinks. That doesn't mean that we can never consume, or that we're going to recommend drinking these distilled alcoholic drinks instead of a fermented one, but it's these are data that I find interesting, and that's why I wanted to share it with you. This is a table that we created in the past, and we are updating it every year to make it easier for the patients. Lists are very complex, and we've seen that different research groups are behind the analysis of foods regarding histamine and other amines. And there is no defined value of quantities of histamine. We've seen that it's a molecule that can grow depending on temperature, the storage time, depending on the handling of the foods. So it is very complex to talk about numbers. So on a daily basis, what we do the first day is to give them this list before we design a low histamine diet for them, so that they get acquainted with it. And in the first diet phase, we divide the treatment into 3 phases. In the first phase, which is 4 to 8 weeks, we base most of all on those foods on the first pillar here, low histamine accumulation foods. And as the patient is recovering, we incorporate other kinds of foods, for example, 1 a week or 2 a week, and of course always with supplementation. Why do we do that? Well, basically because we do not want to generate the fear to the introduction of foods, because in the future this could be counterproductive for the patient itself, and we could end up with some kind of food disorder, and also because we want to avoid nutritional gaps or lack of some nutrients. So there will be patients who will follow the diet very well, but there will be others that will just focus on 2 or 3 types of foods, and this could lead to the deficit of different minerals or vitamins. This is an example of a diet that we created for a patient. She was in the second phase. On Wednesday and Saturday, as you can see, there were 2 foods which were moderate, like spinach and tomato. But this was a patient that had already improved quite a lot, so we could incorporate moderate, histamine moderate foods. It is very important that you as health professionals, and I know that there are many doctors in here today, it's important to work hand by hand. This multidisciplinary work is essential. And when the doctors have patients in front of you, please think about it. If you have a clear diagnosis of DAO deficit or deficiency, please work hand in hand with the nutritionists and dietitians, because these kinds of diets are not easy. And although having this low histamine diet, some patients think the first day, oh, this is easy. There are patients that just say to us, we're just eating rice with chicken. This is low histamine, but it's not a balanced diet, as you know. So it is difficult to generate rich and savory diets and that are good for those patients and are low in histamine as well. So the number 1 rule would be always working with a dietitian or nutritionist, if possible, specialized in this, to personalize these diets as much as possible, because they are very different from what they usually do. So these dietitians and nutritionists, if you're listening to me, try to approach them as much as possible, guarantee seasonal products and proximity products, and also take into account those nutrients that could generate this nutrient scarcity. Well, we could sum this up into these 5 nutrients. Calcium, because it's a diet in which we're going to eliminate dairy products. Cheese, cured cheese, and blue cheese, and also the cheese that we call manchego, and any other kind of cheese which is not fresh. Also milk, because it's been described as a liberator of endogenous histamine. And sometimes we would keep a yogurt, but only in some cases. Omega-3, it's an essential oil, and that's very important at the level of supplementation. We will not have a blue fish and other also nuts, and it's important to take into account these fatty acids when elaborating the diets. Also iron, because when we get rid of these fermented meat products, there are patients who limit the consumption of egg, because as you know, the egg white will be taken away, so they automatically get rid of the yolk as well. I am hearing some voices. Maybe you could, okay. Then we would also have vitamin C. It's not that we could have a lack of vitamin. It's a difficult deficit of, it's difficult to have a deficit of vitamin C. But patients are scared when we talk about them, about diets with no citrus fruits. So they say, well, what am I going to do without it? I'm going to have a cold. I'm going to catch a cold all the time. There are many vegetables which have a vitamin C, many fruits, and like, for example, red pepper, which have an important quantity of vitamin C, and we need to take them into account in this kind of diets. And finally, vitamin D, because as I said, bluefish will not be incorporated, at least in the first phase of low histamine diet. And many times the patient automatically completely eliminates egg, because they do not want to get rid of the white of the egg and separate it from the yolk. So the yolk would be the only source which would be rich in vitamin D. And sometimes we have to use supplementation for that. And this would be the second part of the treatment. These would be the complementary or supplementary part of the treatment. We have different supplements that we can use, but normally DAO and Zyme is the basic supplement that we give to the patients from the very beginning as a shock therapy, a high dosage of it before every meal, breakfast, lunch, and dinner, 20 minutes before, so that it can reach the duodenum. That's where it's going to act. And as the patient gets better, and most of all, depending on the origin of this DAO deficit, whether it's genetic or acquired, we would use a higher or a lower dosage in the treatment, in the long-term treatment of this patient. But it's clear that within these first and second phases, with the introduction of foods, we would keep that in the majority of meals. There are several brands in the market, and as health professionals, we have to identify which ones of them will guarantee a proper supplementation and thiamine oxidase activity. As a rule number one, and I'm not talking about DAO, but in general, with all kinds of supplementation, we need to assess the ingredients that appear in this supplement. I say that because nowadays there are supplements that can generate doubt and can lead us to erroneous concepts, because they're sold as, for example, histamine intolerant, appropriate, but in the ingredients there is no DAO, so they're just vitamins and minerals. So as a rule number one, they would have to have these diamine oxidase. The origin of this DAO supplementation, or a regulated one, is animal. It's animal origin, and we'll see that. But this morning we saw with Oriol Comas that work's being done in a very fast pace with vegetable DAO, but that hasn't been tested on humans. So far we can only base, or we can only recommend at the level of safety, the animal origin one. Thirdly, and this would be linked to the fourth point, the assessment of the activity of this DAO, and this activity would be linked to the quality of the product.
Taking all these factors into consideration, we can recommend one supplement or the other. And secondly, as I mentioned earlier, we would have other types of supplements that could be present or not. In the future, in a near future, we can benefit from a vegetable DAO for those patients that are vegetarians, that follow vegan diets, or because nowadays they are not consuming pork meat, for instance. There are other supplements that could be used or not in this type of diets. We would have probiotics. On the other hand, we would have flavonoids, like the quercetin in this case. And this has an antihistaminic nature at a low level, of course. And we could supplement chia with omega-3. And therefore, I think we're doing okay with time. I would share with you this clinical case. I believe it is interesting, and it may generate questions in the discussion period if we have time for that. In this particular case, we have a woman, a 35-year-old woman with gastrointestinal disorders. Basically with these symptoms that you see here. And she had all kinds of specialists. She had tried all kinds of diets. She was taking out gluten, then it was back, and she couldn't find a solution. This is quite common. Most of the patients that we see come from many specialists, and sometimes not self-diagnosis, but after looking a lot in Google, etc. As we have mentioned extensively in this meeting, to have DAO deficit, we need to have 2 to 3 symptoms of histaminosis, too much histamine. And therefore, our job is to ask, to try and find what problems are seen. Symptoms that they have probably have never paid attention to, because they could be insignificant for them or not very relevant. So in this case, apart from diarrhea, and other abdominal problems, hypertension, fatigue, lack of concentration, itching on the skin, and flushing and pruritus, and also muscle and joint pain as well. And a question that we always ask to patients concerning sports. This question is clear. If after physical exercise, especially in patients with dermic patients, if after a physical exercise intense, it has to be intense, not just turning around. if the symptoms become worse, digestive or dermic symptoms or neurological symptoms or respiratory symptoms? And the answer is yes. There's a very interesting study on sport, several ones, but one in particular that explains it very well. Apparently, physical exercise, intense physical exercise, could liberate histamine in mastocytes. So therefore, we would have endogenous histamine in the patient that is liberated by the mastocytes, plus the histamine that is in the system. Due to the DAO deficit. This does not mean that everybody having intense physical exercise, they will have problems with histamine. But obviously, this would aggravate the symptoms in the case of this type of patients. We asked about the allergies in the family. And in the case of this particular patient, her father had environmental allergies and her mother migraine. Sometimes they don't even think about it because this girl didn't have any kind of allergies or migraine. But it is quite relevant to ask this question. And we have to do it even if they are not typical symptoms from the patient. But the DAO deficit itself, the genetic variants, in the case we're speaking about a primary type of disorder, when we see family symptoms that are related with the DAO deficit, we have to think about the genetic test, because it is an information that probably will help diagnosing in this particular case. This is what we did, and we'll see this. The analytics was quite complete. So it was a DAO deficit that had been treated twice. There was a recovery, but in the last test, there was still DAO activity. So there was a hint there. There were family genetic previous cases. Apart from genetic elements, there was something already there that had been improving throughout the years for some kind of reason that we don't know yet. But she had reduced the histamine by herself. She had managed to decrease the inflammation, but still had a low value of DAO. And this is essential. It is essential to assess the nutrition of this patient. A week before coming, she has to tell us what she eats, both in breakfast, lunch, and dinner. She would have histamine-rich food. Each morning, she had coffee with lactose-free milk in the end, and orange juice. 3 days a week, she had tomato, 1 day calamari, aubergine, and cheese. And in dinner, we had salmon, 2 days eggs, and 1 day banana. Some of these foods, as we have mentioned earlier, that there are elements that do not contain histamine. They are rich in other amines, but just maybe the patients have been exposed to them throughout the years, and in the first stage, we prefer to reduce them to see an improvement. We therefore apply a low histamine diet for 4 weeks with DAO enzyme supplement during 4 weeks. And at that stage, we request the molecular genetic analysis of diamine oxidase with the 4 variants that we know so far. The one that we've seen this morning by Dr. Ruiz. What was our surprise when we saw the following? In the second follow-up visit, after 1 month, the feces were more consistent. In the Bristol scale, became type 5. During the first week, she said that she found specific changes concerning the redness. She still had hypotension, lack of concentration, muscle and joint pain. The results of the genetic test were positive, as we expected, in the 4 variants. In 3 of them in a nitrogen base, and the 3rd variant, which is the most, the one related to a higher activity of DAO, we see the 2 nitrogen-based altered. So it is DAO reduced activity. So what did we propose in this particular case? To continue with a low histamine diet in the first phase, 4 more weeks, and continuing with the DAO supplement for 4 more weeks to see what happens. The summer went by, August went by, we didn't meet, and the following visit was in September, 2 months ago. She had made the physics normal. We would speaking about type 4, regular 1, no itching, no redness, no muscular or articular pain. The fact that there was fatigue could be a result that there were symptoms of this kind, but we still have to see it. There's a relation with chronic fatigue, fibromyalgia, and it has to be seen in all the different interviews. There was lack of concentration, and we have not yet improved that. We're working on that. So we started a second phase of diet with food that we agreed with her, things that she missed, of things that we thought were interesting from the nutritional point of view. The white wine was not proposed by us, but she wanted to have that, and we did that 1 day a month. And we continue with the DAO enzyme supplement 4 more weeks. And I think that we will have to see her this month. So if you have any questions on the evolution of the patient, we will be able to share. Thank you very much. Thank you very much for your attention. And I'll be delighted to answer as many questions as you may have at the end of the presentation.